The ethical issue presented in Brittany Maynard's case is whether or not a patient should be able to choose how and when they end their life if they are diagnosed with a terminal illness. Currently in New York, physician-assisted suicide is not legal. We as nurses care for terminal patients until they pass from their disease. At the end of a patient's life, they have the option of hospice, which is comfort care, or the right to continue treatment. Legalized aid in death is not an option we offer our patients. As nurses, we always put our patients first, which means following the ethical principles of our code of ethics and being sure that our patients have the best quality of life, even at the end. The reason why we feel that a situation may be unethical is because we're unsure if it's right or wrong. Looking at ethical principles, we can decipher this. 4 ethical principles that are conflicting in this situation are non-maleficence, beneficence, respect for autonomy, and fidelity. Non-maleficence is the act of doing no harm. In Brittany Maynard's case, some may feel that physician-assisted death could be harming oneself, and on the other hand, Brittany living with a brain tumor without the option of physician-assisted death could also be looked at as harmful. Second principle is beneficence, which is the act of doing good. Letting a patient die as nurses would be not a good thing. However, having a patient live with the worsening quality of life is also not something we want. Autonomy is the third thing. This is a huge one in this situation because it involves a patient's right to make their own decisions about their body. But then as nurses, we can argue, are they educated enough? Are they making the correct decision? So this is why this is in conflict. And the last principle is fidelity, which is about being loyal and communicating with our patients. We may feel that we're letting them down if they're turning to physician-aided death. But on the other hand, we must separate our values from our patients and understand that if this is something they want to do, we need to stand by their side. Provision 1 of the Code of Ethics discusses nurses promoting human dignity and respect for their patients' decisions. In the ANA Code of Ethics, self-determination is discussed in Provision 1. When Brittany Maynard was diagnosed, she chose to end her life because she thought it was more dignified than having the tumor progress. Provision 2 in the code discusses the nurse's main concern being the patient. We always follow the principle of non-maleficence, which is doing no harm. So we can argue that a patient that's going to die from physician-assisted death would be harming a patient. But however, if a patient is suffering, that's also causing harm. By following Provision 2, we need to be aware of our values and make sure that we're not putting our values on our patients and let them make the decisions. Provision 3 discusses a nurse being a good advocate to our patients. To some, we may feel that physician-assisted suicide is questionable practice, and we must protect our patients from this. However, in the states it is legal, we need to make sure that our patients are informed about a physician aiding in their death. If we feel a patient needs more information or does not understand physician-assisted suicide, we need to advocate for them to receive more information before any decisions are made. Organizational ethics have made an impact on physician-assisted suicide by providing guidelines that must be followed. The guidelines include having a prognosis of 6 months or less, physicians feeling comfortable with assisted suicide, a mental exam being completed, and the patient must be educated on the process. Through following these organizational ethics, we can be sure the process of physician-assisted suicide is ethical and fair. As far as nursing implications on physician-assisted suicide, the ANA stated that this does go against the Nursing Code of Ethics. They feel that patients have rights, but there is a limit. Following the ANA statement, the International Council of Nurses stated that nurses shouldn't take a side, but instead be knowledgeable on the topic. Patients come to nurses regarding many things, and assisted suicide is no exception. We as nurses need to be able to inform patients on the topic so that they can make their own decision without us giving our opinion. Using the 6-step process, we can begin by reviewing Brittany Maynard's story, who chose to end her life using physician-assisted suicide. The ethical problems would be moral distress from a nurse's perspective and an ethical dilemma as far as if physician-assisted suicide is right or wrong. Using the ethics theory of utilitarianism, the outcome would be Brittany Maynard dying instead of suffering from the tumor. The deontological approach is the duty, which is for us as nurses, the ANA Code of Ethics, which physician-assisted suicide can go against. Alternatives would have been hospice care, would have been treatment. And for the completed outcome, she did choose to end her life. We can evaluate this by essentially saying that she does have the right to do it based on autonomy, and it is legal in Oregon. So as far as this being an issue in current practice, this might be something we could be seeing in the future.